Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. We're going to be speaking with returning guest Cathy Kuhn. She's joining us here from UpDocs. It's a complete healthcare communication platform for in-person and virtual care. She's going to talk about their recently released Paperless Practice Playbook. Welcome back, Cathy. How have you been?
Great. Thanks for having me again.
For those of our listeners who may not be familiar with you as a contributor, give us a little bit of your professional background and talk briefly about your role there as voice of the customer at UpDocs.
Sure. So my background is that I'm a pharmacist by training. I've spent much of my years in community pharmacy, working with an accountable care organization, spending time in community and hospital practices, working side by side with physicians and helping really be a change agent as we advance patient care in practices. Specifically at UpDocs, I was excited to join 2 years ago because I see technology as such an important player in ways that we can improve our efficiencies and practices, really to have better reach with our patients. You know, at UpDocs, I play that role of the voice of the customer because I am that voice. I provide that industry expertise and feedback to, our teams and really trying to help move technology in a way that's most beneficial for practices and patients.
Now, of course, I did mention that you are a contributor, but it's been a while since you've been with us. What has UpDocs been up to? What have they been focused on in the last year or so?
Wow. I mean, the last year has been obviously quite interesting for all of us. The COVID pandemic was an interesting opportunity specifically for UpDocs because I think for a long time, healthcare, we had been not resistant, but tentative about adopting technology. And we didn't think of it as a must-have. We thought of it as a nice-to-have. Of course, the COVID pandemic really changed that. And so the adoption with technology has really skyrocketed. So we spent most of 2020 really expanding and supporting our telehealth offering. But what we've seen beyond that is that it's not just about telehealth. It's really about that paperless practice as well, and starting to really engage patients and practices digitally. So we've been looking forward to supporting healthcare in broadening their reach and capabilities with technology.
The Paperless Practice Playbook, recently launched by UpDocs. What was the impetus of this program, and exactly what is it looking to achieve?
Yeah, so the Paperless Practice Playbook really highlights just the need that practices have to increase productivity and improve patient engagement, and thinking about how we can minimize all those manual tasks that are contributing to provider and staff burnout today. So the Paperless Practice Playbook really highlights those solutions that we can start implementing in our practices to, like I said, increase productivity, improve engagement, and then reduce burnout. So really, when we think about, again, the pandemic, we talked about telehealth, but, much of it is social distancing. We think about just even using paper, passing paper around is not only a slow process, but touching clipboards, passing around pens, that's timely and also just like cumbersome to sanitize everything. So we want to help move information quickly and also safely. So paperless practice really helps practices do so.
When we're seeing our healthcare provider and they're typing away at the keyboard, barely looking at it sometimes, maybe 20, 35 seconds of actual eye-to-eye contact, it seems that they're engrossed in typing in this information, every little thing. That is going to generate paperwork on the end, is it not? Are we trying to get rid of paper altogether?
Yep. Getting rid of paper altogether is just like a huge time saver in general. So, of course, we don't want to be able to take away from that direct patient care. So what we think of is that outside of the EHR, there's paper that still exists everywhere. And that comes in as faxes, forms in the waiting room. And, as we're inputting that information as a staff member or as a patient, sometimes that requires just, it requires a lot of time to feed and pass that information along to each other. But imagine being in the office and then the physician already had all that information at their fingertips and are able to connect back to you. And that's just, really what the power of moving to electronic forms and documents outside of the EHR, so that the physician has that information accessible and are able to connect back directly to you as a patient.
In your opinion and in your experience, how much does profitability or the problems that lie therein contribute to some of this burnout? And will paperless contribute to profitability? Absolutely.
So, running a business has changed for everyone, and really running a business was cited as the most important thing that practices had been interested in a recent 2020 survey that we did with practices. So running an efficient and profitable business was the most important thing. But, when we think about running any type of business, being efficient, just working on having strong operations is really the foundation so that we can better provide the service or care that we want. So if we think about even just a simple fax machine, maintaining a clunky fax machine is costly and timely and slows down processes in physician's practice. So moving to a paperless process with electronic fax now introduces the fact that you're saving money by not having an actual machine, not having to maintain toner, paper, but then really, again, that time that you're no longer spending on just like even fighting with a fax machine. Sounds silly, but if you're like me, you've fought with plenty of printers and fax machines in your lifetime. But again, taking away that time spent there and putting that time into what's actually making your business profitable is most important.
How do you think that this paperless paradigm will affect employment? Are we going to have to totally rearrange our staff? Is this something that's going to take years to transition?
I think it's really up to each individual practice, but I think that what practices will find is that patients are now starting to demand, and expect a certain experience when they go into an office. So just even for me personally, I've long time had been part of a practice that used paper records, didn't have a patient portal, and I had zero communication with them during the pandemic. And so there's no telehealth offering. It really makes me rethink of what type of experience that they're keeping up to date with. So, I think that they'll quickly find that if you want to accommodate, the changing population, then you will also, really need to adopt technology quicker to make that patient experience better overall.
Cathy, where can our listeners go and learn much more about UpDocs and get some more information about this Paperless Practice Playbook?
Of course, you should go to UpDocs.com, which has a wealth of information. And then specifically, there is information about our Paperless Practice Playbook, which calls out many of our solutions, and two, really to highlight our electronic fax and our electronic forms that really have helped practices with this paperless practice experience and helping improve their overall productivity and patient experience.
Cathy, always a pleasure. Looking forward to our next conversation. And as UpDocs moves forward into the second half of this year, I wish you all the best. Thank you.
Thank you. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Cathy Kuhn. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.